Good morning, everyone. This is Dr. Rohit from Rainbow Children Hospital. Good morning to all of you. Continuing with our Sunday webinar series for parents and families. Today, we have brought a very interesting topic, and a lot of you had asked these questions in our previous webinar. So what we are covering today is nutrition. And even though nutrition is a common topic, a lot of people have a lot of information available. But when we talk about the current situation of the pandemic, the questions are becoming much more specific in terms of what kind of food we should take, what is the nutritional requirement for children at this point in time. Our children are at home, so it becomes all the more important. And for today's session, we have two very good panelists. Would like to introduce them to you. We have Dr. Nitasha Bagga. She's a consultant pediatrician and neonatal intensive care specialist at the Banjara Hills unit. Dr. Nitasha, you can say hi to everyone.
Hi, everyone.
And we also have Dr. Brundavani. She is a consultant nutritionist at our multiple centers. She sits in Banjara Hills as well as in Kondapur, and she specializes in nutrition for the children and expectant mothers. Dr. Brunda, you can say hi to everyone.
Hi, all.
Great. So before we start off, just wanted to mention that Sunday knowledge sharing webinar that we are doing has been a continuous program for us during these tough times. So we started off somewhere in July. A lot of questions were covered on vaccination. Then we covered a lot on COVID-19 in children. How do we manage that? A very important topic of fever in children. How do we differentiate them? And then we went specialized and did a session with Dr. Nageshwar Rao on heart conditions in children. So continuing that, we are moving on to nutrition, and then we'll have a couple more to make sure that we answer all your questions. So let's start off with our session today. We have collated a lot of questions from all our families. So the most common question that we are getting, and Dr. Brundavani, you can help us here, is what are the right foods for children during COVID times? Any suggestion on immunity boosting foods, specific foods which can help? I think that will be very helpful for all our parents and families. Dr. Brinda.
Yes, thank you, Rohit, for the question. And I think it's a lovely question to begin with. Because whenever we get into any kind of health issue, the first thing is what changes should we make in the diet comes up with. Because there's a lot of information that eat this, don't eat that, or this one will be helpful or will be protected and things like that. So in this pandemic and lockdown situations, a lot of information has come out in foods, especially for adults and kids. And the adult food advisors are using for children also. So that's little kind of a discipline. So when we have to think about the right foods for the children, we need to follow the basic guidelines of what is the right diet for a child. So when you decide what's the right diet, from that we can actually take up the right foods for the child. So we have a very simple food guide pyramid, which has kind of 5 food groups, like 5 food groups. The first one is going to be fruits. The second is vegetables, then milk, protein, and grains. So these are the 5 things that the children should have. And the quantities are also mentioned, like 2 fruits a day, and 3 cups of vegetables, and 2 protein serves, 2 glasses of milk, and 6 times cooked grains. So if we know that the child is eating more than, suppose, because of the pandemic and people say we need to have a lot of vitamin C's and we try to give 4 oranges for the child, that means we are unnecessarily doing the sugar loading for the child. So that makes, the child put on weight, or immediately the sugars go high and the sugars go low, and then they are very hungry again. So we need to do the 2 fruits, 3 vegetables, 2 cups of milk, and 2 protein serves, and 6 grains are more than enough. And the most important thing is what proteins should we give? And because this pandemic mentioned about a very kind of important role of protein. So we have 2 kinds of proteins, which are a little technical to understand. That's called as high biological value protein. That means high biological value means it's got all the amino acids in it, and most of them are animal food sources. So there's a question like for the vegetarians or vegans, how do we assist the kind of high biological value food? Very, very simple. That means if 2 low biological value foods are combined together, it would equate to 1 high biological value food. So once we know how many fruits to be given and what to be given to the child, then the next thing follows is the choice. Like the fruits, the choice would be all deep colored fruits and rich in vitamin C. And coming to vegetables would be high fiber and deep color. And coming to milk would be pasteurized milk and depends like whole milk or low fat milk. And coming to protein, as I told you, a high biological value protein or two good low biological value proteins. For example, a khichdi, rice and moong dal together would make a high biological value food for a vegetarian diet. So that's how we try to understand what is the right diet or which is the right food for the baby or the child.
Yeah. So, Dr. Nitasha, you're seeing a lot of children too in the OPD. What kind of nutritional questions are parents posing to you, and how are you handling them?
Yeah, thank you for your question, Rohit. But I think, yes, as Brinda has told very rightly, these COVID times have brought up plenty of questions related to the nutrition to the children, whether it comes to the children, those who are underfed, or the children, those who are even having overeating as well. So we'll deal with all these questions in subsequent slides anyways, but for this particular thing, I would say, yes, we really need to have a higher amount of fruits and vegetables, at least 2 serves of fruits in a day and 2 serves of vegetables with 3 to 4 grains and plenty of water. Coming to immune boosting foods, as Brinda rightly mentioned, a high protein rich food are going to be really helpful, which can be cereals, grains, nuts, and eggs. And if those who are non-vegetarian can have a good amount of egg and non-vegetarian food at this time, that will really help in immune boosting. So I would say there is not very specific guidelines about what are the right foods which you have to use during COVID illness per se, but I would say a good nutritious diet with home cooked food would be advisable at this stage with plenty of fluids and water intake.
That's good, especially when kids are not going out. I'm sure they're off pizzas. So nutritious food must be a reality nowadays, right?
So that helps us. So a
Good.
lot of junk
So,
come down.
Dr. Nitasha, continuing with you, right? Some people do ask this question that, we have natural foods available, but there are just too many external supplements available. So do you suggest any external supplements for the children, or you don't recommend them?
Yes, so I have been getting this question, I think in the outpatient department almost every day, more than 10 to 20 times. Most of the parents are worried about the immune boosting of their children, whether the food is sufficient or not. So I will talk about mainly 3 things, which has been there in the news as well. One is vitamin D, vitamin C, and third is zinc. These are the 3 main supplements which has been very well read across the globe when we really talk about external supplements. So when we talk about vitamin D, it has definitely got some protective effects has been noticed in the children, especially in those who are deficient in vitamin D. And when we talk about the developing countries like India, most of the children are deficient in vitamin D. So there is no harm in supplementing children with vitamin D supplements. But yes, they are normal supplements and not the mega doses, because that can be harmful. When we talk about zinc, yes, zinc again has got in general also it decreases the risk of infections, especially when we talk about respiratory infections. It decreases the number of days of flu infections to 3 to 4 days per se. But when we talk about specific to COVID illness, I would say there are not much research onto it that zinc decreases the illness per se or decreases the number of days, but there is no harm in supplementing zinc again. The third, which I was talking about, vitamin C, yes, it also decreases the duration of the respiratory infections, and it also helps in quick healing. So vitamin C supplementation has been around 30 to 40 milligram for infant and 70 to 80 for children. So this dosage is there sufficient enough in most of the multivitamins. So I would say yes, the standard multivitamin syrups contains these things. We don't have to add extra supplements. Our standard multivitamin syrups for a month or 2 months can be easily supplemented to all the children at this stage.
Excellent. So you talked about 3 things. You said with vitamin D, you talked about zinc, and you talked about vitamin C. So, Dr. Brinda, if you were to say that, specific foods, parents should know so that they don't have to take supplements. Let's tell that too, so that, they are more aware of, how to balance them together.
Yeah. So, a lot of articles and journals have really quoted, how much to be given because, parents are just overdosing children with a lot of food. So to get the recommended vitamin A, you just need to give a medium carrot and a cup of palak. A cup is around 120 ml. Now to get a vitamin B6 in the diet, you need to give 3 foods. One is a banana, a cup of baked sweet potato, because cooking destroys B vitamin. So, baked potato, and 1 boiled egg. And for a B12, you need to do 250 ml milk, 100 ml curd, and a boiled egg. And for folic acid, you just have to give a cup of dal and cup of greens. And for vitamin D, vitamin D fortified milks are there. And country eggs have 60% more vitamin D. And coming to vitamin C, it's around 200 grams of cut guava or oranges or kiwi or papaya is more than enough for a child to get the adequate vitamin C. And coming to E, kind of a handful of almonds and some sunflower seeds and a very healthy cooking oil can do vitamin C. So the dietary recommendations are very, very specific in British Medical Journal. You just have to go through it and fix onto the number of serves that you have to give, and most of them would be adequate in the diet. But seriously, yes, during this illness, supplements are also important because cooking denatures few of the vitamins. So I think you need to follow the supplement advice if it's given.
Very nice. So continue, further, Dr. Brinda. Size of meals of children, should they tend to overeat or undereat? So how do we manage that? And a lot of children, parents are complaining that kids are gaining weight because they're not playing, they're not going out. So any suggestions there?
Yeah, because generally feeding a child is like, suppose you are feeding 1 roti today, the next day you feel like feeding them 1.5. Just increase the sizes. Even with a week, you just try to increase the size. Maybe the stomach capacity has not increased, but we just increase the size. So the size of the child's meal should be a small to medium. So you need to always go back to 2 serves or 3 serves, whatever is the recommended indication. That's the serves that you really need to stick to. Of course, yes, there's a lot of worry that the children are gaining weight during this lockdown because there's no activity, there are no friends, and it's just computer classes and 24/7 sitting at home. And the only available thing is food and a good mommy to cook food, and children can ask for food. So, it's just kind of, there's no limit for that. So now there are a few studies being done in this COVID pandemic situation to really give guidelines how to minimize the child's intake, and that was very, very interesting. It's been published in European Journal of Clinical Nutrition. I need to quote it because in this situation they really did a study and gave us information, so I just couldn't stop quoting the article. But what they say is try giving a plant-based diet from dinners, because plant-based diet and the proteins are very good and rich in amino acids, which can really produce a very good sleep hormones. So sleep is generally for 6 to 8 hours or 10 hours in a child. So when the sleep is protected, that means the morning metabolism is controlled. When the morning metabolism is active and the child is happy and energetic, that means the appetite is controlled. So, they have specifically given us 8 foods to be included past 6 o'clock in the evening. That's oats, greens, boiled or baked sweet potato, bananas, berries, nuts. So these are the ones which have good amounts of tryptophan. That's what the study says, to be given in the child's diet. But from my perspective, working in the clinics for so long, and I understand how to cut down a child's diet because I need to practice. So the best way to do is put some protein food. I mean, suppose a child wants to eat 4 rotis or 3 rotis, and he can only eat 1.5 or 1 roti. You just have to give a protein food before the meal, like you can give some yogurt or a raita or some stir-fried sprouts or some stir-fried non-veg items for the meals. For example, if it's a breakfast, you can give a glass of milk or a scrambled eggs. You just put a protein food just before the child starts the breakfast or lunchtime. So what happens is the carbohydrate content comes down, and children definitely like some kind of grills and these kind of starters. So once they get onto the starters, they're happy and they can cut down their large meals, and we achieve their weight loss or weight maintenance.
Great, great. So one question, Dr. Nitasha, you talked about supplements, right? So one parent has asked that for iron and vitamin, till what age should we continue this? How long should we continue the supplement? Or any specific criteria to say stop it?
See, when we talk about routine iron and vitamin D supplements, we start right away from the birth of day 4 or day 5 of life for any developing countries, for that matter of fact, India or anywhere, and we continue it till 1 year of age. And iron supplements we start somewhere around 6 to 8 weeks of life, and we continue it till 1 year of age. Beyond 1 year, it is not required to continue unless we have any clinical symptoms suggesting of low iron or low vitamin D supplementation. Protein supplementation is recommended till 1 year of age.
Great. So another question that came up is, and Dr. Brinda, I'll come to you also on that. They said, children, if they have constipation, then do we try to change the diet, and still maintain the balance that both of you talked about? Dr. Nitasha, what is your response to that?
Yes, I would say it's entirely a broad topic to discuss. But if I have to answer in one-liner, I would say yes. If a child has already developed constipation, we really need to switch over to a very, very disciplined diet, which includes a lot of roughage, fruits, vegetables, plenty of water, and really need to change the diet chart. Lesser milk, less calcium-containing food items. It's very important that we because we see children having constipation right from the time they start weaning foods, so it really needs to be focused onto it. And before we start any medications for constipation, I would say a good dietary change can really help.
Yeah, and Dr. Brinda, what about this another situation where they say if the child has got mild cough and cold, should we give citrus fruits? The way you said, or should we avoid them?
No, you should give, because see here, once the food reaches the tummy, nothing happens. It's only it's a myth. See, suppose you take a glass of milk or buttermilk, your throat starts itching because the food particles are there, and you secrete a little bit of mucus. That's the thing. So that should not be understood as buttermilk gives cold or curd gives cold, or do not give oranges during cold. Actually, they're immune boosters. They're really good in this particular situation. So it's kind of whenever you eat a fruit or drink milk or buttermilk or something, you just take sips of warm water, and that's the protocol that has to be maintained for the kids, because they don't know how to clear their throat. So that's where they start developing some phlegm and things like that, and it's just related to had a banana and then had cold, or had an orange juice and had cold. That's seriously, I think the myth has to vanish from now.
A very tough question, Dr. Nitasha. I don't have an answer to that. How do you manage the sweet craving of children?
Very difficult. So I would say try to avoid artificial sweeteners and try to give them natural sweet food, which would be fruits. Like if at all you are going, if at all your child is fond of ice creams, homemade ice creams enriched of fruits, and try to put lesser sugar to it. And even if the children are fond of milkshakes, again, I would say add more fruit to it and make milkshake with the fruits than adding sweeteners to it or sugar syrups, or maybe for that matter of fact, any kind of juices which are outside made, prepared fresh fruit juices. So if we put that habit right away, right in the beginning of when we are starting the weaning foods, actually, that will help them in having the taste buds used to that. So avoiding fizzy and still drinks right from the very beginning would be helpful in continuing it for the whole lifetime. So that's the only way which we can do it right from the very beginning. And slowly, yes, over the period of time when we have toddlers, when we have start understanding children 4 years, 5 years, when they start joining the school, a good reinforcement from the school, all those things can really work out. And we do win with the children with this.
Dr. Brinda, have you given alternatives to sweets? We talked about natural sweeteners, but anything else that you recommend to your parents?
Yeah, because this is one question which I always come across my table, mostly. See, the sweet craving occurs at a certain period of time in a day. Though, the whole day the child will not be wanting sweet foods, or any adult also. That would be mostly from 4 o'clock to 7 o'clock or 8 o'clock. It depends upon the metabolism. That means, they're kind of the sugars are low or they're sugar deprived. So, you just have to select the very kind of, happy, maybe a pudding or a pancake or, maybe a fruit yogurt or a dry fruit laddu or something to be given at the specific hour when they're having the sugar craving. And also hydrate them so well that the hormones settle and the natural sugars are released, so they come out of the sugar craving. So whenever anybody has a sugar craving, that's the first question: what time do you like to have a sweet? Is after a meal or after a play or after a study? That means the body needs sugar at that time. So we just have to really camouflage it and give it in a very nice way and tell them they put on weight with this. So they would have it and still have it.
Yeah.
Yes,
So
Dr.
basically, so when it's a classical 4 to 7 is the snack time when they really have, and that is the time when they really have all those things. So if we can
yeah, see, because here the school food is around 12 and 1 o'clock. And after that, they have the play activities. And they travel so, a distance of 1 hour and they dehydrated. They come home and their snacking is unlimited because, whatever they have consumed, they're actually burnt. And the bus snacks are, again a junk. So they're just all over the place looking for food. So, that's the time that we really need to catch up and then put them into a very habitual diet so that, they don't start binge eating and ordering from outside food and, going very low on mood because of hunger and not wants not being fulfilled and things like that.
Yeah. So, Dr. Nitasha, nowadays, so one of the questions that's coming is, do we try to manage what is the best time to have dinner, considering children sleep by 9:30? So, or I don't know whether they sleep by 9:30 nowadays. Mine sleep only at 11, 12. But
Yeah.
what is the best time for dinner so that you have adequate time for them to digest the food?
Yeah, so if we talk about the routine timings, now the pandemic timings have changed a lot. So children have started getting up late in the morning and they are sleeping late in the night. But anyways, either of the ways, I would say 7 o'clock is the right timing to give dinner so that they have enough time to digest it, enough time to assimilate it, and even to have, even after some time after dinner, if they do a little bit of roaming around, playing a little bit, and then go to sleep, would always be better. So if we fix their timing of sleep somewhere around 9, the 7 to 7:30, I would say, is an appropriate timing for children for dinner.
Great. Dr. Brinda, there's a alternate question. We talked about weight gain and avoiding it, but there are some parents who are asking which food is best to encourage weight gain. Maybe the child is quite thin. So what is your suggestion there?
Okay, weight gain is also a very common question nowadays because we have a lot of underweight children. So for the best weight gain, you need to give a very healthy bedtime snack. That's going to be like, a little milk porridge with nuts or some kind of a high density food at the bedtime. And you need to have split breakfast. That means you're going to have two breakfasts. That means you're not going to start the day with milk. You're going to have a breakfast with a carb and a little protein. And again, 10 o'clock, you can have another breakfast with a carb. Like, for example, if you're doing some kind of a khichdi in the morning breakfast, then you can swap for a sandwich or some other carb items at the 10 o'clock. That means it's going to be 2 times carb loading morning and 10 o'clock. And then again, after dinner, we need to have another healthy kind of high calorie snack. And sweet potatoes, bedtime snackers with jaggery and nuts have really shown good results, and even baked beans and sprouts because they promote a lot of growth hormones. So if somebody has to put on weight, always have to put on linear growth too. So we just have to look into that and try increasing the snacking items to be more caloric dense.
Yeah, I think that's very helpful. So there's one more question that came up, Dr. Natasha. See, we talk about we said you said children jump around and they digest foods, but the other change that is happening is they are sitting a lot in front of the computer, right? So there is strain on the eyes, etc., which I don't know whether we have seen before. Any food items that might help in managing that stress, eyesight, etc. Very generic, but any suggestions?
See, not Not per se to this particular COVID times and stressing on the eyes, but yes, we have good vitamin A rich food, which should be anyways be a part of a routine healthy diet, which can help. But if we talk about a lot of stress in the eyes and if any food which can help it out, I would not say much specific food, but a healthy food which is good in vitamin A rich, like carrots, like palak, all those things would really help. But I would say screen time and management after that is very important. It is very important if your child has already started having difficulty or stress in the eyes or strain in the eyes. It is very important to visit the pediatrician or an ophthalmologist so that we can have some good tear supplements, because the strain can go up on increasing, because see, we do not know till when this time lasts. So the recommended screen time is very fixed for every age group. So if at all your child is suffering, don't ignore it. Come over, review with your pediatrician so that we have a few exercises which we can suggest when it comes to the straining of the eyes. That will help. And there are various ways with which we can decrease the screen timing during this pandemic also. And also very important at the same time to suggest is exercises at home. I know you would not want your children to go out, but along with the food, focusing on the food habits, whether your child eats less or more, either of the ways, keep on doing a basic exercises for them at home, like simple jumping, running around, so that they do some physical exercise. And a lot of activities can be done at home. It's very important to do those activities so that they do not land up into a sedentary lifestyle. That's very important at this stage.
Yeah, okay. That's good. So now we'll just move on to the questions that we had. Another question that comes up, we talked a lot about food. So Dr. Nitasha, what about water? What's the suggestion on water intake? And obviously it might be linked to the constipation also we talked about. So a little bit of an idea there. And then Dr. Brinda will come to say how to make water interesting.
Okay. It's very important to have, I mean, water is very essential, we all know, whether it comes to regulation of body temperature, getting rid of waste from the body, or lubrication and cushioning effects of the joints everywhere. Water is very important. So if your child should be averagely having water of around 8 to 10 cups in a day, that's just an average amount I'm giving approximately, but if your child is able to have more than that, that would be very good. This includes the sources of water from everywhere. It's not only plain water which your child should have. It might be as a part of milk, it might be as a part of food, vegetables, fruits, all those things also includes that. So there might be like your child does not have water. A lot of parents come and ask that question, and Brinda will also answer that. But from my side, I would say if your child does not have plain water, please do not hesitate to give other sources of water, like unsweetened milk is one of the 80% of milk contains water. So 250 to 300 ml of milk in a day can give 80% of water. Fresh fruit juices, citrus juices, melon, orange, apple juices can also provide water. Certain vegetables which are rich in water like cucumber, tomato, spinach, that also increase the quantity of water. And somehow you can interestingly make water, maybe add a little bit of jaggery, which also makes water interesting. You can add some fruit cut pieces into the water, which makes colorful. So a lot of toddlers love doing those games and have water. So these are the few tips which I always give to the parents, and it really helps them. So that helps in. But only thing which I would say is avoid sweetened fruit juices, sugary syrups, fruit juices, concentrates, and fizzy and still drinks. These are very important to be avoided as a source of water. They can be given occasionally, but not as a source of water.
So Dr. Brinda, now I'll take you to the next problem that people have. All that you say is good. My child is fussy, picky, doesn't eat, doesn't drink. What do you do then?
See, hunger and appetite are natural for every living thing on earth. So, somebody is not hungry and not eating and being fussy, that means their hunger is kind of, not represented there. So generally, kids, whenever they say they're fussy eaters or just not hungry and refusing food, the first thing is we need to check what kind of craving do they have, sweet food craving or salt food craving. Suppose they say, they like most of the salted foods. So, most of the 50% of the meal has to be managed in something like baked potatoes or patties or boiled corn or grilled paneer, where salt can be added and 50% of the diet can be given. Suppose the child prefers most of the sweet craving, so you can work on pancakes or yogurts with fruit or dry fruits, things like that, and also see which time they really crave for this. And there's another thing which stops hunger. That means kind of timetable feeding. Like when the child gets up, there's a glass of milk, and then there's a breakfast, and then there is a snack. So we tend to feed children on a scheduled base. So hunger may not respond in a scheduled base because of their activities or the sleep or things like that. So whatever we need to give to the child, distribute it in such a way and identify the hunger zones where the child is. Or if you think the child is not hungry for lunch at 12 o'clock, make the child play at 11 o'clock. So the natural hunger is there and natural thirst is there. So we can actually build up a system. So it's nothing like that, we need to give this food to the child to be hungry. No, we need to make the child get the normal appetite and hunger and also understand the taste and make it easy for the child to take it in, because when the child digests the food, that's when the child grows. Just force feeding or distracted feeding will not make the child grow, but only will make the child concentrate more. So we need to help the child eat better by understanding the child.
Yeah. So, Dr. Nitasha, now just moving on to another topic which is there, which now let's go on to much smaller children, right? And you are a neonatologist, so people asking questions: should I breastfeed during the pandemic? What precautions can I take so that me and my child are safe? Can you please answer that question?
Yeah, so answer to that question is absolutely yes. You must breastfeed. There is no doubt about it that you should not breastfeed. Breast milk provides a lot of antibodies. It provides a lot of bioactive factors, which actually, if given to a newborn baby, can save them with a lot of infection. That includes COVID-19 as well. Even if, for that matter of fact, if the child gets COVID-19, the breastfeeding biofactors as well as the antibodies would really help saving the child and dealing the infection much better. So yes, but precautions has to be taken in this pandemic, whether you have COVID-19 or you don't have as a mother. Use standard precautions, wear mask, make sure that you are washing hands properly with soap and water or alcohol-based rub after touching and before touching your baby. Clean and disinfect the surface where you are touching. And many mothers ask this question, do I actually need to clean my chest and breast before I breastfeed? I would say once or twice bathing in a day is more than enough. You do not need to clean it every time when you are going to breastfeed. But yes, only one small condition where you are actively coughing onto the breast for some reason, there are some secretions while sneezing or coughing. Yes, it becomes very important that you clean your chest or breast either with an alcohol-based rub or with soap and water. So these are the standard precautions I think which most of the mothers would be following, and you must breastfeed during this pandemic. There is no doubt about it.
So, Dr. Brinda, a little bit, can you mention about foods for the young mother, so that as Dr. Nitasha said, breastfeeding is very important. Any recommendations for young mothers so that they're able to pass on that nutrition to their children?
I mean, you asked me the pandemic situation.
Yeah, generally, but in pandemic it becomes more important. So it's a common question.
See, off late we've got a lot of calls saying that inadequacy of breast milk. I think because of stress, because delivering in a pandemic situation, I think women went through a lot of stress and uncertainty. I think that's where they build up a lot of stress hormones. That's where the lactation is come down. The best way to actually build up lactation is to have a very high carbohydrate diet. That means, whenever you need to breastfeed your baby, you need to have a little around 10 to 15 grams of carbohydrates. But don't bank on bread and other sources where it can make a lot of weight gain. So you can choose options like a vegetable juice or barley water or plain rice starch, where you can add something like which can help breast milk, like you can add some kind of methi or palak or some of these other things which help breastfeeding mothers.
Yeah, okay, that's good. So, Dr. Nitasha, just if you take it, little that argument a little further, the questions are: should I breastfeed if I have or I'm suspected to have COVID-19? Can I pass COVID-19 to my baby by breastfeeding?
See, to date, if you ask me, transmission of active COVID-19 through breast milk or breastfeeding has not happened. There are few occasional case reports here and there where the COVID-19 virus has been detected into the milk, but it's not yet confirmed. So I would say do not worry if you have or if you have suspected to have COVID-19, because the benefit versus risk of breastfeeding in COVID-19 is much, much higher. So I would say if you have so much of benefits of breastfeeding, if there are some occasional case reports, I would not stop breastfeeding. And I don't think so that there has been any significant case report saying that COVID-19 has been passed through breastfeeding. So I would still continue the breastfeeding for the mothers.
Okay, that's good. So you have been, Dr. Nitasha, you have seen that we are offering home quarantine services, right? So in that case, is breastfeeding, new mothers, any specific advice that you have been giving them?
Yes, we have plenty of mothers who have delivered with the Rainbow Hospital COVID Center who were positive, and subsequently most of the newborns has been detected negative, and the best thing about it, they have been breastfeeding. Some of the mothers, those who were symptomatic, yes, we did advise them to continue breastfeeding, but we expressed the milk and have fed the baby. So mothers usually wash their hands properly, clean the breast, express the feed, and give it to a healthy caretaker who feeds the child either with a palada or a spoon or a bottle. So that has really worked very well, and none of our newborns have got affected with that till now. So there has been, I won't be able to tell exact numbers, but yes, I would say a lot of mothers, those who are COVID positive, has been on home quarantine and has been with us on the home quarantine services and has been taken care for the breastfeeding very well.
Dr. Brinda, there are a lot of people who have been asking that, are you available for consultation? Can we come to the hospital? Can they come? Is it safe to come to hospital? That's a question that.
Rainbow Hospital is COVID free. We admit COVID children in road number 10 Rainbow Hospital. So this center is absolutely safe, and all precautions are taken here. And this is a COVID free center, so there's no doubt about it.
Okay, so basically, then they can come and consult you or Dr. Nitasha anytime.
Yes, I must a point over here that it's very important to remember that COVID-19 has not taken off many other illnesses. We still have typhoid, we still have malaria, we still have dengue. So plenty of times there's a lot of awareness about video consultations at this stage. A lot of parents get connected to us with video consultation, but plenty of them do not also. But I would say that yes, do not miss any fever or every cough and cold is not COVID. And you must not miss those. So many times we have seen patients coming with the missed diagnosis of dengue because the fever has been going and they're scared to come to the hospital. So make sure, be vigilant, and if the child is continuing to be unwell, don't feel unsafe to come to the hospital. And anyways, the Banjara Hills branch is not having any patients with COVID, so you can definitely visit, and there are all the precautions which are being followed over here. So don't miss the child diagnosis just with the scare of COVID. That's very important.
So, in this situation, a lot of doctors are having video consultations. So, are you also available on video consultation for the parents and families? There are questions about people asking.
Yeah, definitely. We are there for the video consults. We are there from morning 9:30 to evening 5 o'clock.
Excellent. So, Dr. Nitasha, a question for you. Just a second. Yeah. So actually, for Dr. Brinda, exercise. We talked about exercise. So how do you intersperse that or do along with healthy nutrition? That's a very important part. Both of you touched it. So Dr. Brinda, can you just little bit explain on this one?
Yeah, exercise too had guidelines from American College of Sports Medicine for this pandemic time, because parents are really worried children are just sitting and what to do, how to do, and things like that. So the guidelines are for 3 to 5 years. 3 hours of activity a day could be a normal activity or moderate to high intensity activity. That means we need to engage for 3 hours. And from 6 to 12 years onwards, it's going to be 60 minutes of activity a day. Could be 5 to 10 minutes spread throughout the day, or 30 minutes twice a day, or 60 minutes at a go, and 3 days of rigorous physical activity. And for children who are into sports, there are guidelines to put them into a training day module, and the guidelines have been given from American College of Sports Medicine, what exactly to be done for swimmers and basketball players so that they keep their physical fitness. And also Eat Right organization had given the guidelines what diet to be given pre and post exercise. So the guidelines stays this way: 1 to 4 hours before any activity, carbohydrate foods to be given. And these are not breads, but bananas, or baked potato or sweet potato or corn. That means healthy carbs to be given 1 to 4 hours before the activity, and within an hour after the activity to be given a protein and a carb portions. And the proteins should be rich in calcium, should be milk and yogurts, and also the carbs should be a fruit or dry fruits. So strict guidelines have been given, and there's an indication for parents to understand that the heart, muscle, and the bone to be involved. That means little hearts and bones and muscle. That means they should be aerobic, they should be strength, and there should be a kind of jumping and these activities, so that parents would understand what a physical activity is. Because once we send the children to school, the physical training happens in the school. We are really ignorant of how to really train a child in such situations when they're absolutely at home for months together. So the guidelines are very, very specific for us with the diet and the activities, and we can download the brochures, and the child also can go through that and understand, oh, this is how I need to be fit at home.
Dr. Nitasha, little unrelated question. We have answered this in our previous webinars, but because you are a pediatrician and a neonatologist, is it safe to come for vaccination to the hospital? Can we delay it? We have answered this to death, but still great to hear from you.
Yeah, absolutely. I would say you can come for the vaccination. At this point of time, we are having a separate vaccination clinic which runs morning 9 to 10, which is only for the newborn follow-ups and the vaccinations. There are some of the vaccinations which can be delayed, but I would say few vaccinations which are fixed for the birth vaccination, 6 weeks, 10 weeks, 14 weeks vaccinations should not be missed at all, and the 9 months vaccination, which is measles. But apart from that, if you talk about a 1 year and a 2 year vaccination, if at all it is delayed by a month or two, also does not matter much. But few vaccinations, as I told, 6 weeks, 10 weeks, 14 weeks vaccinations, 6 months, and then 9 months vaccinations are very, very important and should not be delayed or missed, because the time gap between the two vaccinations is very less. So if we delay one vaccination, the next vaccination gets delayed hugely. So yes, but if you want to come, morning hours are the best time to come.
Excellent. So going back to you talked about breastfeeding and you gave some good advice. Obviously, there are some questions about weaning. So now if the situation is where you're trying to introduce new foods. So in this situation, this current times, do you have any other special advice for weaning for children, or your advice remains the same? Some thoughts on that will be helpful.
Weaning is a very elaborative topic to talk on. We can talk almost a day on it, but I would say specific to COVID-19, there is no such difference which we would make for specific weaning. But only thing which I would say, if your child is sick, if your child is unwell for some reason, wean the foods carefully, and with the consult of your pediatrician, you can have a video consultation and video chats if at all your child is not tolerating some specific foods. But specifically for COVID season, I would say there is no any difference in specific weaning advices at this stage.
Okay, Dr. Brinda, some people have specific questions. I'll take one by one. Short answers from you. Can we give milk during bedtime? 18-month-old small girl. Is it okay to give milk before sleeping?
You definitely can give milk before sleep, but not a bottle feeding. And you need to brush the teeth after giving the milk. And no additives in the milk, because they don't need boosters for a bedtime milk.
Good. What's the ideal time for children to have their breakfast by?
7:30 to 8, because it's the time that the body is metabolically active, to 3 hormones. So 7:30 to 8 is the breakfast hour.
But that's very tough, Our children don't get up by 9. So what do we do?
Okay, wake and sleep cycles are very important because most of the growth happens during the sleep. So growth hormone is very, very high from 11 in the night to 3 a.m. So the first thing is sleep has to be corrected.
So I want to add here, Rohit, I think it's a lot required from the discipline in the parents at this stage. So I would say a lot of parents, those who are working from home, have also lost their discipline. So when they work from home, they work overnight, they get up late in the morning. So I would say they really need to maintain the same. If they do well, they would be able to maintain the discipline with the children as well. Children getting up early in the morning depends a lot on the parents and not on the children per se. Sleeping also late in night also depends on the parents, I would say. They have to take a lead, switch off the lights by 9:30, they go to bed, and morning they will wake up. So if you keep working overnight and get up late, obviously you can't expect your child to get up at 7:30 and have breakfast alone. Right? So that's one of the things which I would really enforce. It's very important, especially because we don't know till when this lasts. It might be another 6 months also. It will really affect the children's health. So it's very important to have discipline among the adults.
Great. So, yeah, Dr. Nitasha, we covered, I've been going through all the questions that are coming. We covered a lot of them. I think very useful information both of you have given. Let's just try to summarize a bit. So, typically people ask the question, 5 healthy eating tips for families having small children. Dr. Nitasha, first you cover, then Dr. Brinda will come to you also. That will also become an effective summarization.
So 5 healthy tips are very less actually when we sit here talking as a diet chart, but still I have concised 5 of them which would be working out for I think most of the parents. The very first is keep up the fruits and vegetables. It's very important, fresh fruits and vegetables. I know it's a difficult time and you might not be able to keep a supply of fresh fruits and vegetables all the times, but if at all it is possible, it's very important to keep up the intakes of fruits and vegetables. So what if fruits and vegetables are not available? It's very important that we have dried goods available ready with us, like beans, pulses, grains, lentils, split peas, rice, quinoa. All those things are the second best if at all you are not able to have a fresh fruit supply with you or vegetable supply with you. Second important is build up a stock of healthy snacks. It's very important, as Brinda also told in the previous listing, the snacking time between 4 to 7 is the time where they really happen to have a junk, and especially this timing when they're not tired after the school, they really want to eat a lot. So oats with milk, nuts, raisins, yogurt, curd, boiled eggs, these should be a part of your healthy snacks. The third would be limit highly processed foods. That's very important. And fourth, I would say cook at home. Most of the parents are definitely cooking at home and they are trying to not avoid food from outside, but I would still reinforce that it's very, very important because home cooked food, you really know what you are giving to your children, amount of calories, proteins, what is going on, fat, sugar, salt, restricted amount of everything, you know what you are doing. So that would really help them in long term with obesity, overweight, and chronic diseases like diabetes and all. Very important point which I want to reinforce is make cooking and eating as a fun point. Don't make it as a tug of war between the parents and the child. It's very important, especially this is for those who are fussy eaters and those who do not eat. Just leave them alone, give them a few different ways to eat together, cook together, involve them in helping you cooking, washing items, sorting out few things, putting up the table, setting up the table. All those things are really going to help them a lot. And the last but not the least, the fifth one is it's important to maintain the normal levels of essential vitamins and minerals, as deficient state can increase the risk of infection and ability to fight with the infection. So keep up the amount of vitamins and minerals. If you really feel your child is not eating well and is a fussy eater, there's no harm in supplementing with a good vitamin supplements at this stage.
Yeah, I think your advice of involving the children in cooking is very nice. It's just that cleaning after them becomes a bigger problem. So that increases the work.
Discipline from the adults is required at this stage. It's not a children's problem.
Dr. Brinda, lot of tips were covered, but being a specialized nutritionist, any other 3-4 tips that you can pass on to our parents?
Tips or guidelines? Okay. basically try to maintain your meal timings. So, your rhythmic hunger and digestion is protected. No matter what, keep alarms and, at least for a month, streamline your hunger and digestion. Then balance your morning and evening. It's not that every day could be a postage stamp pack, like, you can eat more in the morning or evenings. So try to balance your calories from morning to evening. You can punish yourself if you eat in more. So maybe you have a birthday party and really binge eating today. The next day, the same time for your dinner, you will just have a bowl of fruit so that you remember that you've eaten binge eat or taken a large quantity the previous day. So, correction is very, very important because we know we are doing wrong, but we're not able to control ourselves. So, you need to follow your timings and you need to balance from the morning to the evening. And you need to really punish yourself if you really eating too much. And hydration is very, very important because once you are sitting and screen time is more, you get very dehydrated because you're just sitting there and just, continuously sitting there for 3 hours, So these are the times that you can have a bottle of water and hydrate yourself. And try to do 10,000 steps a day. That's very, very important. And maybe, you should complete 10,000 steps and then go to bed. So it's some kind of, check-in list you need to have from morning to evening because your body is very important for you to do what you want to do in life. So, you need to care for it. You need to look into it and understand it, just not by listening to information and just putting onto you. No, it's not that way. You need to understand your hunger, your digestion, and your health, and your exercise, and how you're actually taking care of your diet. You need to have an insight from now on.
Great. Another question that comes up because in India we all have homemade remedies stuff available. So Dr. Brinda, does this is it advisable to give kashayam to children or any homemade kadha and all that we talk about, Dr. Nitasha? Do you recommend it or do you say not to take it?
No, it is a very drastic actually, children, most of the children don't digest or, they're very kind of ulcerated. So do not just listen to all this and give, a lot of haldi or a lot of tulsi waters and things. You can do it in moderation along with the food, but just not the moment they get up, just try to give a kashayam as the early morning kind of, drink. This is not favorable for a child's digestion.
Dr. Nitasha, any view from you?
See, there are a lot of practices which has been there when we talk about elderly people telling or in this particularly pandemic season. But I would say anything which is not very much evidence-based should be avoided for the children. So if there is a lot of evidence behind it, if we read a lot about it and we know that it is going to be safe for the child, I would say we can consider it, but we really should look into the benefit versus risk ratio and then go for it, especially for the children. You can't do a hit and trial with the child.
Excellent. So I think we have covered all questions. Any last summary, Dr. Brinda, for the parents? Quick couple of lines, then we will close out.
Child's diet is important. We need to sit down and understand their body composition. That means, what's their height and what's their weight, and do we need to look for a weight management? I mean, losing their weight or gaining their weight, and to look into their plate. Are they eating more or less, or they have some food craving or sugar craving, or I think this is the time that we need to take time to look into their diet and activities and streamline to some extent and, can talk over. We have a lot of time to discuss so they can see the videos and, kind of come to a conclusion that they make a 7-day meal plan and, some kind of a healthy lifestyle starts with it.
Great. Dr. Nitasha, any last lines?
I would say stay safe, stay healthy, eat healthy, and feel free to reach out us if any kinds of doubts or questions with you. Thank you.
Great. So we just wanted to mention both the doctors are available in the hospital. They have been working through the pandemic for the last 5 months. Hospitals are open. You can come consult them. So Dr. Nitasha Bagga, her email ID is Nitasha, nitashabagga@gmail.com. And Dr. Brundavani is available also on email, Dr. Brundavani at rainbowhospitals.in. You can visit our website. You have information available on both of them, their timings, and you can always set up appointment with them and have a discussion with them. They're always available to help you guys. So thank you everyone for joining us for this Sunday session. Stay home, stay safe, and eat well. Bye.
Thanks, Rohit. Thank you all.